Thank you for joining us for our webinar, How to Gain Control of Your School's Health Plan Cost. At the bottom of the screen, you'll see several widgets for your use during the presentation. For example, if you have a question, please click the purple Q&A icon to the left. We will answer any questions at the conclusion of this webinar. Speaking today is Andy Neary, National Advisor Partner Strategist at Captivated Health. Andy has over 15 years of experience helping employers impact the rising cost of healthcare through innovative strategies. The number one factor driving your current and future health insurance costs is how, when, and where your plan members utilize the healthcare system. Andy's strategies help employers cut through the complexity of a broken healthcare system and lead to improved benefits, a positive member experience, and significantly reduced health insurance costs. At this time, I will turn it over to Andy.
Thanks, Ashley. Thank you, everybody, for being on the webinar today. My goal today is to share a couple ideas with you that could help schools take control of their health plan spend. And where this all began was Borslow Insurance is a consulting firm in Boston, Massachusetts, and we've been in operation for 35 years. The company was founded by Jim Borslow, and over those 35 years, we were in a very unique position that we were fortunate to develop working relationships with over 100 private independent schools in the New England market. And these schools all purchased their health insurance in three large purchasing consortiums. One was in the state of New Hampshire, one was in Maine, and one was in Massachusetts. And these were fully insured consortiums, or what we might call MIWAs. And they all faced the same challenge, and that was growing membership. Because when you're a fully insured trust or a fully insured consortium, you are not allowed to cross state lines. Therefore, growing membership was very hard. Well then, when the rules of the Affordable Care Act presented themselves, some of our schools were going to be getting kicked out of these consortiums due to the rules around community rating. So we knew we had to act fast and we had to act quick. Thus, Captivated Health was born out of a need to serve our clients. So on July 1st, 2014, 10 of our existing client schools jumped in and helped us create Captivated Health. And we are excited to say as of July 1st, 2017, our program now includes 31 schools, which represent 3,500 faculty and staff roughly, and well over 7,000 total belly buttons when you include both spouses and dependents. And when you look at the list of schools, we're excited now to include schools such as the likes of Phillips Andover, Phillips Exeter, and the St. Paul schools, three schools that are considered some of the top schools in America today. So, how did we get here? As a health insurance industry, how did we get to the point where we knew we had to create a different model for our private school clients? Well, in 2010, when the Affordable Care Act presented itself, we knew one thing. This meant change. And new rules around community rating, new regulations were going to force our schools into a different thought process. And the one thing that the Affordable Care Act did address was the insurance side of our industry. And it made sure that those folks who are uninsured at the time had insurance. However, it did miss the ball on the biggest problem with our health insurance programs back in 2010, and that was the costs that are tied inside the health care system. And health insurance has been a direct beneficiary of what is going on inside the healthcare system today. The cost of health insurance has far outpaced both wages and inflation. And what's interesting is when you look at 2010, when the Affordable Care Act presented itself, we were all told costs were going to go down at that time. And unfortunately, costs have continued to rise since. And when we talk to most schools, this is a big concern because the cost of health insurance is typically the second, maybe the third highest expense on the balance sheet. And there's not another expense rising faster than the cost of health insurance, nor is there another or a bigger source of revenue or tuition leak sitting inside most schools. And what's happened over time, when you look at how advisors and the health insurance industry has helped schools design health plans, by and large, we have been building health plans backwards. And what do I mean by that? Well, first, we typically pick the carrier. And for those schools who are purchasing in the fully insured world today, it's typically the carrier that offers the lowest premiums, and it makes sense. Step two is we look at the network of doctors and hospitals from that carrier to make sure that it adequately covers all faculty and staff and their dependents. And then the third and final step is to pick the deductibles, the out-of-pocket limits, and the copays from a list of plans the insurance carrier offers. Now, as insurance costs continue to increase, most schools have been forced to shift the burden. So over time, deductibles have increased, coinsurance has been reduced, out-of-pocket limits have been increased. We're asking faculty and staff to pay more. We might even switch one carrier out for another. And this is all done in an effort to mitigate rising health insurance costs, which makes sense. The problem with this strategy, though, is it ignores the biggest problem in the health plan today. The problem is not the plan design. The problem is not the insurance carrier. The biggest problem in the plan today is the experience that faculty and staff are having inside the healthcare system. I don't care if a school offers a $500 deductible or they offer a $5,000 deductible. This experience today is frustrating. And I like this depiction of Atlas, though it's a cartoon depiction, because today the faculty and staff that have to access the healthcare system, they feel a lot like Atlas does in this image. Because the world that they're shouldering today is the world of the decisions that have to be made when healthcare happens to them. When they have to access the system because of a need tied to their healthcare, that decision-making process, that navigation is very confusing, it's very frustrating, and it's their decisions. Think about this. It's the faculty and staff decisions inside the healthcare system that are driving our health insurance costs of our schools. And the biggest problem right now is what school officials see as a medical ID card. Faculty and staff see as an unlimited school credit card. And as long as they stay in network, they can go wherever they want, and they can spend whatever they want. So how can we help faculty and staff? How can we build a health plan that makes this navigation of the U.S. healthcare system effective, efficient, and easy? And that's what we're here to talk about today. So I'm going to go into 3 ways that you as a school can start gaining control of your health plan costs and start helping your faculty and staff and their dependents to have a different experience with the healthcare system. Step 1, you see an image there of a garbage can. Step 1 requires us to essentially throw away an old strategy that we have used time and time again in the health insurance world, especially for those that are fully insured. And I think you're going to understand what I mean when I say this. This year's health insurance renewal feels a lot like last year's health insurance renewal. It looks a lot like it did 3 years ago. It looks a lot like it did 5 years ago. And what's happened over time is we have come to accept what I like to call predictably bad outcomes. And some of you might be familiar with this conversation. The renewal comes in at 12%. Your advisor asks you, hey, how much of an increase are you willing to absorb this year? And so we tell them, we say, well, you know, the finance team and the finance committee has budgeted for a 7% increase. So the advisor goes back, and if they have the ability to negotiate, then they negotiate the increase down to 7% and everybody's happy. Well, at the end of the day, this is still a 7% increase that the school has to take on. And for the schools, this is a predictably bad outcome. And so it's how can we stop allowing predictably bad outcomes to wreak havoc on our health plans. I kind of liken it to compound interest. As schools, if we continue to allow an 8%, a 10%, a 12% increase to impact our health insurance costs, we will look back 10 years from now, and we'll have witnessed our health insurance costs increasing by 60, 70, and sometimes 80%. And it's inside the health plan where the faculty and staff are accessing the healthcare services they need that is driving our health insurance costs increase. If you think about it this way, starting to control the health insurance spend inside our plan starts with this one formula. Whether your school fully insures today or it is already a partially self-funded plan, the majority of your costs are directly or indirectly tied to the claim activity that's occurring inside your plan. And calculating that claim activity comes down to one formula. You might want to write this down. It's the total number of units of care multiplied by the cost per unit of care. Or said in a different way, the total number of claims multiplied by the cost for each claim. And to give your school the best chance to control the increases you are witnessing with your health insurance costs, we have to start reducing the unit cost per claim. What does that mean? It means that when our members, our faculty and staff, enter the healthcare system, we have to help them slash the cost of what they're paying inside the healthcare system. So how do we do that? I'm going to give you guys, or use a golf analogy with everybody on the call today. If you think about the game of golf, you need a golf bag and a set of golf clubs to play a round of golf. And when you go out and you play golf, and you play that round of golf, the shot you are faced with will dictate the club you use. So when you think about it in terms of health insurance, what we're doing is we're developing or building a golf bag or a health plan. And our objective is we have to flip the script, flip the plan design on its head and build the entire structure of the health plan around the faculty and staff's experience with the healthcare system. So we need to fill this golf bag with golf clubs or tools and resources so that when faculty and staff have to access the healthcare system or go out and play a round of healthcare, they have a tool to use based on the healthcare need they have. If you think about the fully insured plans we are buying today, the fully insured plans today have been built for and by what we call the rule makers. Those rule makers include the government, they include the big hospital systems, the big pharmaceutical companies, and the large insurance companies. And they are designing the health plans that we all buy for our faculty and staff. And unfortunately today that model has one very predictable ending. The rule makers win and our schools lose, because when our schools have a bad year, think about when you've had a bad year of claim activity inside your plan. Your next fully insured renewal represents that because you see a very large increase. However, when you have a really good year with your fully insured plan, the profit retained in that health plan stays with the insurance carrier and you still see an increase the following year. So how do we, again, flip that script? And instead of building a health plan around the rule makers, how do we build a health plan around our faculty and staff? Again, we have to fill the golf bag with a set of clubs, a set of tools, so that when your faculty and staff go out and play a round of healthcare, they have a tool to use based on the healthcare need they have. So how the heck do we do that? Well, I thought the best way to talk about this today would be to tell a story. So we're going to talk about Joe the consumer. Now, let's look at what the typical health plan for Joe the consumer looks like today. First, Joe's employer, like most employers, gives him access to a really big PPO network of doctors and hospitals. And most employers think that's a good thing. The more choice Joe has, the more flexibility he has, the better it is. But what the school, Joe's employer, doesn't realize is that first of all, he has to navigate this health plan on his own. And the second thing is there's a huge variance in the price and the quality of what Joe's about to buy. So let's look at what could be a very typical healthcare year in Joe's life. First, Joe is experiencing a migraine headache. And instead of getting a hold of his primary care doctor, Joe does what a lot of consumers do today. He runs to the emergency room. And on Joe's health plan, he has a $200 emergency room copay. But what Joe doesn't realize is that that 1 hour visit to the emergency room cost his health plan $2,000. Joe also takes 2 medications. The first medication he takes is a drug by the name of Crestor, which is used to help Joe take care of his high cholesterol. And on Joe's health plan, that drug runs with a $30 copay. So it costs Joe $360 a year. What Joe doesn't realize is the actual cost of Crestor to his school's health plan is about $5,000. Now, Joe takes a second drug called Wellbutrin. Wellbutrin is used to treat mild depression. Now, that drug is a bit more expensive, so to Joe's health plan, on Joe's health plan, it costs Joe a $50 copay or $600 a year. But Joe has absolutely no idea that the actual cost of Wellbutrin on an annual basis to his health plan is over $25,000 a year. Now, later that year, Joe starts experiencing some back pain. So he makes an appointment with a specialist at the local hospital. And the first thing the specialist does is they run an MRI. And because that MRI was done at the local hospital, Joe's health plan requires him to pay a $100 copay for diagnostic imaging. So again, Joe has absolutely no clue as a consumer that that MRI that was provided at the hospital actually cost $3,000. Specialist takes a look at the MRI and tells Joe that he definitely does have a bulging disc, and he recommends surgery to repair that bulging disc in his lower back. So 2 weeks go by. 2 weeks later, Joe ends up having back surgery to repair his lower back. And again, for Joe's plan, that does cost him his deductible. But Joe has no idea that that 1 hour back procedure cost his health plan $50,000. So what you can see here, folks, is Joe didn't have a catastrophic year, but he had some claim activity, and added up, all of this adds up to $85,000. Now, most of that is falling on Joe's health plan. And this is a major reason why health insurance costs for our schools continue to rise, because it's decisions that are made inside the healthcare system that drive our future health insurance costs. So how can we help Joe? How can we give Joe tools and resources, those golf clubs, to slash the cost of what he's paying when he has to enter the healthcare system? Well, the first thing we can do is we can give Joe telemedicine. And telemedicine gives Joe the opportunity to get a hold of a primary care doctor over the phone. Instead of running to the emergency room when he is experiencing his migraine headaches. And instead of the bill running around $2,000 for the 1 hour emergency room visit, one call to a primary care doctor on the phone cost Joe $49. Now, in addition to that, Joe also has access to mental health practitioners over this telemedicine program. So before, when Joe was a little embarrassed about his behavioral health concerns, he now can have those addressed from the comfort of his home by getting a hold of a mental health practitioner over the phone through a program called telemedicine. Now, what about Joe's prescription drugs? Remember, Joe takes 2 drugs, Crestor and Wellbutrin. Well, Joe's school could now give him access to programs like GoodRx, where Joe can go online to a free app and Joe can determine which pharmacy in his neighborhood is dispensing his Crestor at the lowest cost, saving Joe and his health plan a ton of money. Joe also has access to a program such as CannaRx for his Wellbutrin. Because when you look at many of the high-cost brand and specialty drugs that we find in our school clients' programs today, most of these high-cost drugs are produced in 6 Tier 1 English-speaking countries. And those countries are England, Canada, Ireland, New Zealand, Australia, and South Africa. And so when you look at a drug like Wellbutrin, in America, that drug costs north of $25,000. Now, through a program like CannaRx, Joe would have the ability, if he chooses voluntarily, to have his Wellbutrin directly shipped from the manufacturer of Wellbutrin, who is located in Ireland, because in Ireland, Wellbutrin does not cost $25,000. Wellbutrin costs $1,200. So not only can Joe now reduce his own out-of-pocket costs by accessing Wellbutrin directly from the manufacturer, Joe is significantly reducing the cost of that drug on his school's health plan. Now, last but certainly not least, we've got Joe's low back problems. Remember, he saw a specialist who ran an MRI at the hospital for $3,000. Joe's school now gives him access to a program that allows him to call an advocate who can help Joe locate an imaging center that provides the MRI, the same MRI, not for $3,000, but for $500. And if Joe chooses to have his MRI provided at that facility, not only will Joe save himself and his school a ton of money, his school is actually going to send him a check in the mail as a thank you for choosing a lower cost, high quality option. And now what about that back surgery? Remember, that 1-hour procedure cost Joe's health plan $50,000. And what Joe doesn't know, like most consumers in healthcare today, is that roughly half of all the back procedures we provide in this country are unnecessary. So now Joe's school gives him access to a second opinion program where Joe can have his tests, his images reviewed by multiple surgeons around the country who are going to give Joe a second opinion, which may come back and say, Joe, surgery is necessary, or it may come back showing that Joe doesn't need back surgery whatsoever. That, of course, a treatment of physical therapy is actually a better option for Joe. Not only saving, again, Joe a ton of money, but saving his health plan significant amounts of money. So my point, folks, is when you take this golf bag, this health plan, and you fill it with tools and resources so that when employees have to go out and play a round of healthcare, they have a tool to use based on the healthcare need they have. And when we can help them slash the cost of what they're paying inside the healthcare system, we start reducing our cost of health insurance. But here's the thing. Providing faculty and staff with all of those tools is the right thing to do. It's effective, it's efficient, and it works. But if faculty and staff don't remember they have those tools or they don't know how to use them, they're useless. And everybody knows who's been part of an open enrollment meeting, faculty and staff forget most of what we told them at open enrollment meetings, right? So when 6 months go by and healthcare happens to Joe, he's probably not going to remember the tools he had. So the last step, the third step in helping your school take control of health insurance costs requires you not only to give your employees, your faculty and staff, that golf bag with those golf tools, but you have to give them a caddy as well. You have to build in an advocate, a concierge service, so that when healthcare happens to your faculty and staff, they don't have to remember that they have those tools built into the program. They don't have to remember how to use them. All they have to remember is, all they have to remember to do is get a hold of an advocate who can help them navigate that journey through the PPO network and use and utilize all the tools and resources they have. So in summary, folks, step one, to start containing our health insurance costs requires us to stop allowing these predictably bad outcomes, these 6, these 8, these 10% increases to impact our health insurance plan. The second step requires us to take the design of the health plan and flip it on its head and no longer make it about the rule makers. We have to make it about our faculty and staff. And the final step is when we build in the tools and resources to help our employees navigate the healthcare system where the majority of our health insurance costs come from, we have to give them a caddy, an advocate, who's going to hold their hand throughout the entire healthcare journey. So to finish, why would a school even consider Captivated Health as a solution? Well, number one, our program is built around the member. Everything we do is for the member, and it's to help the member slash the cost of what they're paying in the healthcare system without sacrificing quality. We're giving schools the decision-making control. Our program is not governed by those so-called rule makers. Our program is governed by the schools and member schools of our program. In Captivated Health, our schools are also getting access to plan data. One of the most important ways to gain control of your plan spend is to have access to what is being spent inside your plan. Our schools have that access. It's about creating transparency. You see every penny you pay or every penny you spend in Captivated Health, and your faculty and staff now are creating transparency in the services that they're purchasing inside the healthcare system. This program has national scale and reach. We are building a community of private independent schools around the country who are coming together to put a stop to these out-of-control rising health insurance costs. And most importantly, this is strategically collaborative. So of our 31 schools, each and every one of those schools is collaborating with one another so we can continue pushing not only those schools and their health insurance costs down, we can start pushing the health insurance industry forward. Because the best way to pay for healthcare or to pay less for healthcare is to pay less for healthcare. So I want to thank everybody today. We wanted to keep that short and sweet. I hope the attendees in the audience found this beneficial. Ashley, I think we're ready to take some questions if anybody has it.
Yes, if you have any questions, you can submit them via the purple Q&A icon at the bottom of your screen. We'll give you a few seconds here to see if any questions come through. All right, well, it doesn't look like anyone has any more questions. So again, thank you so much, Andy, for today. As you exit the webinar, please take a moment to complete the brief questionnaire that appears so we can address any feedback you may have for us. And if you do have any further questions, they can be sent to myself at Ashley Whalen at corpsyn.com. That's Ashley, ASHLEE.Whalen, WHELAN at CORPSYN.com. Thanks for your attention, and please enjoy the rest of your day.